In this video, we'll discuss the increased intracranial pressure. Just think high pressure inside the cranium, the head, which put loads of pressure on the brain, which puts loads of lot of pressure on the brain. This one squashing, eventually squashing the brain stem cell which control breathing and heart rate, and this eventually kill that patient. So here because of high pressure inside of our cranium head, high amount of pressure to our brain, so it will cause us squashing that brainstem which control breathing and heart rate, so it causes death the patient. Now what are the causes? Increased intracranial pressure. Causes can increase pressure inside the head from increased bleeding in the head, increased bleeding head from an aneurysm stroke. Because of stroke, we get burst blood vessels. Because of stroke, then burst blood vessels that now fill up the brain, causing increased pressure. So stroke, burst blood vessels, increased swelling in inflammation condition from head trauma or even meningitis. So predominant causes stroke, burst blood vessels, then inflammation, trauma and meningitis. Now coming to pathophysiology, just think this increased pressure compresses the brain. So initially it compresses the blood vessels that carry oxygen to the brain. So here increased pressure compresses the brain, so comprises the blood vessels that carry oxygen to the brain. So less blood means less oxygen, resulting in a change of level of consciousness. So decreasing change of level of consciousness from cerebral hypoxia, that low oxygen to the brain, reduced level of consciousness or decreased mental status, that is earliest sign of increased intracranial pressure. So low oxygen means low consciousness or mental status changes, also known as altered level of consciousness. Then sign and symptoms. The early signs: altered level of consciousness, LOC, altered level of consciousness. That one also called irritability and restlessness. Irritability and restlessness, only called altered level of consciousness, as well as decreased mental status. Then we can see sleepiness and drowsiness. So decreasing mental status, so here we can see sleepiness and drowsiness. Irritability, restlessness, called altered level of consciousness. Then decreasing mental status, sleepiness and rest, this one, sleepiness and drowsiness. Then moderate sign, we see headache, then sudden vomiting, that is emesis, vomiting only, emesis without nausea. So headache, vomiting, that is emesis and nausea. Then lastly, increased intracranial pressure, build it, put a lot of pressure on our brainstem, lot of pressure to brainstem, so which control heart rate and breathing, so it leads to irregular breathing and other vitals. So in the lungs, we will see irregular respiration. In lungs, irregular respiration, that is known as chimney stroke respiration. Irregular respiration is known as chimney stroke respiration. This is basically fast and slow breathing. In the neck, we can see uh, ruchal rigidity. Patient complain they cannot flex chin towards chest. So all the pressure inside the brain is pushing down on that brain stem, causing herniation. Now, key signs that brainstem is affected. The pupil will be fixed and dilated and sometimes unequal. So this is all about increased intracranial pressure. Causes, then pathophysiology, then sign and symptoms early, then moderate late. Thanks for watching.